Let's take a call from Patrick in Nigeria. Patrick, welcome to Straight Talk Africa. What's your question?
Yeah, good evening. I want to find out from the doctor. My name is Patrick Okorafor here in Aruchuku, Nigeria. I want to find out from the doctor. Doctor, do we say that this Zika virus, do they have special food? People who are suffering from such virus. And are we saying that this Zika, is it hereditary? If a mother happens to suffer it now by giving birth, will his own child put to birth, will he or she, that will she suffer such a virus in future?
Okay,
Thank you very much.
Thank you, Patrick. I didn't get part of his question, but I did hear him ask whether it's hereditary. If you have an unborn child and the child gets the virus, is it likely that that child may pass it on? Josh, would you like to take the question?
Yeah, I believe the question was around whether you're infected, how long-term are the consequences, and whether it can pass through generations. I don't think that there's any reason to believe that it could be passed on through generations. Really, the link that we're worried about here is between a woman who is pregnant who is infected and their unborn child developing birth defects. Other than that, there is not too much of a concern, and certainly not a concern across generations. So let's say a woman who is not pregnant who becomes infected, yet then clears the virus or recovers from the virus, no longer has the virus in their blood, there is no reason to believe that she would be at risk for any serious health complications from Zika itself, or if she gets pregnant in the future, that baby would be at risk for any complications either.
Yeah, very interesting, because one may wonder, if you're pregnant and your child is already infected with that, what are the likelihood that this child is going to grow into a normal child? Will they have, some mental challenges, Dr. Ron? Those are some of the concerns.
That's right, and we don't even know that because microcephaly has not been studied in as much detail as it might be. So there's a wide range of consequences to children who are born with a small head size. Some people are entirely normal and will go about their lives just like the rest of us. We wouldn't even know, to tell you. All of our heads are of different sizes, right? Yeah. So we wouldn't even know if someone happened to have a smaller size. But those people whose brains don't develop adequately in the uterus, who may be born with a small head size, they may have a wide range of deficiencies growing up. Anything from difficulties learning. Some people with microcephaly have difficulties moving around. Their nervous systems are affected. Difficulty seeing. There are a lot of vision difficulties. So it's a very wide range of symptoms. It's a tragic occurrence. It shouldn't be diminished in its importance. And I think that doing whatever is possible to identify the cause of abnormalities in an unborn and then newborn child, anything that can be done should be done. If there's an infectious disease cause, we need to definitely establish that fact and do everything we can to reduce the risk of infection.
Carol, maybe I turn to you, because also some of the concerns from pregnant women is, as the doctors will advise you, don't take certain medication when you're pregnant, and of course there are those the trimester, the first, the second, and the third, and so everything varies. What are some of the issues that you're coming across as you report on the Zika virus?
Well, some governments have told women not to get pregnant. And one government said, like, for 18 months, I believe was the term, not to get pregnant in the 18 months. Well, here in the United States, 50% of all births are not planned. So telling women not to get pregnant, unless you supply them with effective birth control, to my mind, it doesn't do very much good.
And I would think it would be the same kind of challenge even in Africa, where most of our audiences are, that you don't really know when you're going to get pregnant. And some of them, for religious and cultural purposes, they will say, no, you cannot tell me when. I can get pregnant and when I cannot get pregnant. And maybe there'll be no measures to put in place. But Josh, as you look at the kind of funding President Barack Obama is asking to be able to contain the Zika virus here in the United States and elsewhere, what are we really looking into? What kind of measures would be put in place, or what are we actually looking into?
Right, as was said at the beginning of the hour here, there has been a request from President Obama to Congress for $1.8 billion in additional funding to address Zika, and that's both here in the United States and internationally, mainly in Latin America and the Caribbean region. And this follows on the heels of several years ago when a similar request was made by the President of Congress for additional funding for Ebola. In that case, it was $5.4 billion. But in the Zika case, what the President is asking for is the additional money to really support the laboratory and the surveillance research needed to understand more about the virus itself, how it's spreading, and also to inform the studies of this link between the virus in pregnancy and the birth defects. But also mosquito control systems, public education for the states in the United States which may be at risk for Zika, and we've already seen some cases in the United States, but also part of that money for other countries to support their efforts to control mosquitoes, to educate their public, and to do the research and evaluation needed to understand more about the virus. Now it's up to Congress really to say whether they agree with this amount, or whether change the amount or change the emphasis, provide some limitations or change it a bit according to their beliefs. And so we'll see how that process plays out. But it does seem that there is a bipartisan support for some kind of additional budget on Zika.
Well, very key, because whatever comes out of this U.S. study and everything being put in place can be shared by the world. And on that note, thanks to our distinguished guests, Josh Michaud with the Kaiser Family Foundation, Dr. Ronald Waldman, a professor at George Washington University, and Carol Pearson, VOA's health reporter. Thanks to our affiliate stations, along with our viewers and listeners, we thank you for tuning in.